We are into our final talk before we get into the question session. So I have Dr. Lizzie Sweeting. Lizzie is a salaried GP, but she's also very busy. She leads various programmes at the Improvement Academy, Martha's Rule, and the Deterioration and Just Culture. And she supports the Perinatal Culture and Leadership Programme across Yorkshire and Humber. And she's got a passion for leadership and culture during a time as the Clinical Leadership Fellow at the Improvement Academy. So the floor is yours.
So I'm not going to be teaching you anything new today. So the first half of this presentation is just going to go over and hopefully solidify some things that my colleagues have already said today. You might notice a few familiar approaches that are listed in slides. And then I will briefly touch on Martha's Rule and how that might work in maternity settings, recognising that I'm not going to be able to give everyone answers here. Before I kick off, who has heard of Martha's Rule in the room? Oh, this is excellent, wonderful. And who is linked in with their Martha's Rule teams at their local trusts? So a few hands, excellent. So hopefully it's just a brief overview of Martha's Rule and deterioration, and any questions, please do get in touch after us. So, I'll just move on. So you've seen this before. So this is the peer approach. You'll notice that the P is slightly different in each presentation. So it can stand for prevent, plan, prepare. And that is what we can do to minimise the progression to more deterioration. Then we step onto the identification. We've talked about the use of early warning scores. So in the maternity setting, we're talking about the new national MEaCC. In other meetings, I'm discussing PEWS, NEWS 2. In care home settings, things such as Restore 2 Mini. So how do we identify deterioration? Then we move on to probably the bit in between identification and escalation, maybe the trickiest bit, or the potential for where things can fall through the cracks. So someone notices that someone has deteriorated, but they either feel like they can't speak up, or when they do speak up, their message isn't heard. And if it is heard, is it understood and acted upon? And then how we respond to deterioration. And none of us are on commission to talk about the peer approach today. We've all done this independently. So thinking about in maternity settings. So in preparation for today's slides, I went through at each stage of the deterioration journey and just pulled out some themes from national reports, papers, cases where things has not gone wrong. So you can see there that quote in terms of prevention. So it wasn't clear that staff always knew that someone was at risk of deterioration, so that the plans might not be in place. And we've just heard about how, if you anticipate deterioration and have the kit there, that you're more likely to be able to deal with it and sort it out and prevent further deterioration. Thinking about identification, so in some cases, multiple clinical staff have not picked up on deterioration, and we heard that in Hayley's case. Even when she was there bleeding, that wasn't necessarily identified that she was at risk of deterioration there or deteriorating. Thinking about the escalation stage, so we can see there that when someone did escalate, the woman, in this case, who was pregnant, trying to tell everyone that something was wrong, and she felt that she wasn't listened to, and she was treated quite patronisingly, and that she didn't feel listened to. And then in terms of the response, so in certain stories, even though the first three things have been done, the appropriate response hasn't happened. So this is an approach that I talk through in various settings, so paediatrics, care homes, maternity, and I think it just helps break down the patient journey. So how do we escalate concerns around deterioration? We've talked about MEaCC and that tool, NEWT 2 as well, for the neonatal setting. We think about soft signs, so is someone passing urine? Do they have changes in their breathing? Are they more confused? And then this bit that I'm going to talk a bit more about is around worry and concern. So that is the voice of either the patient, the family, the carer, or the staff. Is there just something that is not quite right, and you need to escalate it but don't know how. And that's how we've come to Martha's Rule. We know that when incidents happen and things go wrong, that communication and culture thread throughout everything. So how can we foster a culture and teamwork where everyone feels that they can speak up, whether they're the most inexperienced person on shift, there's a massive hierarchy, how does, someone who is a patient feeling extremely unwell, in a severe amount of pain, but recognising something isn't right, how do they get listened to, and how can we be open to listening to their concerns, even, for example, if their physiological assessment was okay. So what is Martha's Rule? Now, this has come from a case of a child down in King's College, London, where the team didn't act on the parents' concerns. And so basically the gist of this new rule is that there are 3 components in order that staff have access to a rapid review from critical care outreach team if they've got concerns. So staff has a route, patients, families and carers have that same route to access a rapid review from a critical care outreach team. And then the third part of this is, how do we routinely ask our patients and carers what they feel about their condition? Do they feel worse than before? And different trusts are approaching this in a different way, but it's about having that systematic way of engaging with patients and their families and carers. Now, this is the current wording of Martha's Rule. For example, we're doing some work in paediatrics at the moment. Only one of our trusts in the region has a paediatric critical care outreach team. So it's not obtainable in every trust around the region. But how can we make it work for different settings is what we're considering. Now, there are 143 pilot sites in England doing this work at the moment. So they've all been given a small pot of money for this year to test the ideas around Martha's Rule, to see if their current processes and pathways align to the components, and actually that third component, how do they incorporate that into their everyday practice. We've got 10 official sites in Yorkshire and Humber. If you are wondering if your site is one of them, please do get in contact and I can put you in contact with their implementation groups. The emphasis is that this year is a learning year. So there's 143 pilot sites, which if you were designing a programme around learning and improvement, you would never choose that many. But it is around learning and seeing how things can work, because we know, one hospital in our region, for example, Airedale, very different to, say, Sheffield Children's, which is also very different to Hull. And so we know that different approaches to implementing Martha's Rule will be needed in different organisations to meet the requirements of the components, but also to fit in, what's already going on, what services have been developed in that local site. Pressed the wrong button. And so how is it currently being implemented? So we're quite early on still. The expectation is to test the idea of Martha's Rule in adult and paediatric inpatient settings at the moment. That is the minimum expectation. But I know there are some sites in the region that are already thinking about, how does this work in the emergency department? How does this work in maternity settings? How does this work in neonates? And so across Yorkshire and Humber, we have got a Martha's Rule learning community that anyone is welcome to join. We host monthly online meetings where we talk about quality improvement and how we can learn from each of the sites around the region. You don't have to be an official pilot site to join us in that. And then we're working on a separate piece of work around the paediatric element of Martha's Rule, recognising that we don't have the infrastructure to be able to offer a critical care outreach review in the majority of our sites. So it's very early learning at the moment, and Brian and colleagues at Bradford have been doing a lot in terms of the lead up to this, working on a previous pilot around worries and concerns and spotting deterioration earlier. So we're doing a lot of learning from our colleagues in Bradford, which is really helping us as a region. But if anyone is interested to learn more about Martha's Rule, please do email me. And so how will it work in maternity settings? So the impression I get in any Martha's Rule meeting I go to, everyone wants me to have an answer. I don't have the answer. And particularly in maternity, I think we have the opportunity to shape what the answer could be. And so if anyone is interested about talking about this further, please do get in contact with us. It'd be really good if we could say to our colleagues nationally, look, we're ahead of the game in Yorkshire and Humber. We've been thinking about this. This is how it might work in our units, and kind of set the agenda. And this kind of brings me on to a bit of a plug for an event that we will be putting on, date and time to be confirmed, bringing together all of our programmes of work under the Patient Safety Collaborative banner in Yorkshire and Humber. So Martha's Rule and Deterioration, Perinatal Culture and Leadership, our MEaCC team, and also our System Safety team, which is looking at learning from events and PSURF, and trying to bring that all together, because in every presentation today, deterioration has been mentioned, culture has been mentioned, leadership has been mentioned. So how do we create the culture in which patients, families, carers and staff feel free to speak up? And so I think it's really important, thinking about what Hayley was saying earlier, how we listen to those voices in order to manage deterioration. So if anyone's interested in any of these programmes of work, please do get in contact with us. We're hoping to do something that will bring all of those things together in a workshop face-to-face day. So keep your eyes out for that date. So I will leave on that note.